Today we are diving into something truly amazing in the world of medicine. We're talking about a brain scan for dementia that's basically a two-for-one deal, giving doctors a much clearer picture of what's happening inside the brain. Let's get right into it. Okay, so let's start with a big question, right? Diseases like Alzheimer's, they happen deep inside the brain tissue. So how in the world do you actually see what's going on in there while a person is still living without doing something invasive? That's the huge puzzle that medical imaging is trying to solve. You see, getting a really solid diagnosis for dementia is a bit like putting together a puzzle. It's not enough to just see one piece of the problem. To really understand what's happening, doctors need the whole picture, the complete story of the disease. And those two big puzzle pieces are what we can call the cause and the effect. For Alzheimer's, a major cause is this buildup of gunk, these harmful proteins called amyloid plaques. But that's only half the story. Doctors also need to see the effect, the actual damage this is causing to the brain cells, the neurons, and how it's slowing them down. Seeing both, that gives them a ton of confidence in their diagnosis. So, how do they see that effect? I mean, you can't just look at a brain cell and see if it's working properly, right? Well, there's this brilliant biological shortcut called neurovascular coupling. Basically, your brain is super efficient. Wherever your neurons are firing and working hard, the body automatically sends more blood. It's that simple. So if you can map the blood flow, you get this fantastic map of brain cell activity. All right, so if doctors need to see both things, the cause and the effect, what was the old school way of doing it? Well, for a long, long time, the process for getting both of those images has been, let's just say, slow and really inefficient. I mean, just look at this workflow. A patient comes in for one scan, say, to look for those amyloid plaques. Then they have to go home. They wait. They have to schedule a whole separate appointment to come back for another scan to measure the brain's metabolism, that effect we were talking about. It's just a huge hassle for everyone. And you can just imagine all the problems this creates. We're talking multiple visits for the patient, who's often already dealing with difficult symptoms. It means more radiation exposure, it's more expensive, and for the hospital staff, it's a total scheduling nightmare. Clearly, there had to be a better way. And guess what? There is. This brings us to the really clever part, a fantastic breakthrough that some people are calling the coffee break method. And it's all about one simple idea: getting one scan to do the work of two. So here's the secret sauce. It's not some new billion-dollar machine. It's not a new drug. The secret is all about timing. Researchers had this amazing realization that a single injection of a radioactive tracer, the stuff they use in PET scans, actually tells two totally different stories depending on when you decide to look. Here's how it works, and it's so smart. A patient gets just one injection of the tracer. Right away, in those first 10 minutes, the scanner captures how that tracer is moving around with the blood. Bam! That gives you the effect image, the map of brain activity. Then the patient can literally take a break, go have a coffee. When they come back about 90 minutes later, a second scan shows where that exact same tracer has now had time to settle and stick to the amyloid plaques. And that's your cause image. One injection, one visit, two completely different pictures. It's brilliant. So this two-for-one approach is a total game changer. It gives doctors a much richer, more complete diagnostic picture, all while making the entire process so much simpler for the patient. And here's why having both pieces of info is so critical. As Professor Barthel explains, you can have different types of dementia that both show that amyloid buildup. But the pattern of the brain damage, that neurodegeneration you see in the blood flow image, can look completely different from one disease to the next. This helps doctors tell the difference between, say, Alzheimer's and Lewy body dementia. And it really all comes down to this: two crucial answers, one for the disease's cause and one for its effect, all from a single streamlined procedure. This isn't just a small improvement. For patients and doctors, it's a revolution in how we diagnose these diseases. And this isn't just some abstract idea. In the clinics that have already adopted this method, like in Leipzig, Germany, the neurologists now consider this dual information absolutely essential. They demand that both the blood flow image and the amyloid image are included in their final reports. That tells you just how valuable this is. So what's next? This technique has already proven its incredible value. But believe me, the story is far from over. Let's take a peek at where this is all going. So right now, this method is in routine use in some pioneering medical centers that have validated it themselves.
But for this to become a global standard, the next step is to run larger studies across multiple centers. That's what will provide the high-level evidence needed to convince regulatory bodies and the entire medical community.
Now, what's incredibly exciting is that this idea could be used for so much more than just Alzheimer's. The same basic principle, getting a blood flow image and a specific pathology image from just one tracer, could potentially be used for diagnosing Parkinson's, grading brain tumors, understanding epilepsy. The potential is just vast. And the workflow itself could get even more efficient. The ultimate vision is to have smaller, compact PET scanners located right in the same room where the tracer is administered. That would make the whole coffee break scan incredibly fast and easy. You know, this whole journey leaves us with a fascinating thought. We've seen how a clever insight about something as simple as timing turned two scans into one, revealing both the cause and the effect of a disease. As our technology gets better and our understanding of biology gets deeper, it really makes you wonder, what other complex stories are hiding inside us, just waiting for the right moment to be revealed by a single scan?